In this video, you will learn what happens with your baby this week, what happens to your body, things to do or consider this week. Feel free to leave a comment if you have questions. Did you know that your child may already have a head full of hair this week? In this and the upcoming weeks, your baby's lungs will be prepped. They are prepped by the release of a substance into the air sacs of the baby's lungs. This substance ensures that the lungs do not collapse after birth. If everything goes well, the respiratory system will start automatically after birth. A beautifully designed system. At 42.4 centimeters and a weight of 1,652 grams, your baby is as big as a Chinese cabbage, as heavy as an adult guinea pig, and his skin is no longer transparent. Unfortunately, you will notice that the number of pregnancy ailments are increasing. Your belly is getting bigger, and that makes everyday life more and more difficult. Are you still working? Depending on how you've planned it, you can almost start your maternity leave. During this period, it can be nice to get some extra breaks at work. In many countries, it is legally established that you are entitled to these. Contractions. Already? Yes, in this week you can already suffer from contractions. These are also called practice contractions, and can start from week 32. These contractions are also known as Braxton Hicks contractions. You recognize them because they do not last long, and do not succeed each other at fixed intervals. During this week, you will also notice that it is becoming harder to breathe. This is because the uterus is now so large that your lungs are compressed. It is good for your body to keep moving, but make sure you look for a form of movement that doesn't speed up your breathing. For example, think of walking or swimming. Your shortness of breath won't cause any problems for your baby. Your little one gets enough oxygen through the placenta. During this period, your baby descends. This means that your little one will sink down into your womb, bringing him or her closer to the birth canal. This way the baby is ready for delivery. By descending, you can experience various complaints. The most common complaint is a sharp abdominal pain, usually in the lower abdomen. You can also suffer more from round ligament pain, because your baby is now positioned lower in your belly. Your baby is growing a lot these last weeks, and you will notice that in your own weight. If you're unlucky, there will be more extra pounds due to the retention of fluid. It is important that you eat healthy and try to keep moving around as much as possible. Were you able to send some baby shower invitations? This is a good week to celebrate. If you wanted to know the sex of the baby, you will know by now. This allows you to specifically ask for special gifts. Have you not sent out any invitations yet, but a baby shower seems like a lot of fun? You're not too late. A baby shower is often given in the last 2 months of pregnancy. So now is still a perfect time for a party.